Hello and welcome to our presentation. The UNSDG, the United Nations Sustainable Development Goals, are designed to implement global improvement and correlate with the UNCRC to protect the rights of children globally. Today we will focus on ways to improve the health and well-being of children, asking how the access to adequate water, sanitation, and hygiene affect the health and well-being of children. We strive to create a solution through an interdisciplinary study. We welcome you to Think Different, Drink Different. I'm Faith, and I'll begin our interdisciplinary study with the all-encompassing study of education. We gain our foundational knowledge answering why change in regards to access to adequate water, sanitation, and hygiene is necessary. The biggest indicator for means of improvement is in the statistics. Statistically, 28% of the global population still lacks access to clean water and proper sanitation, primarily in the underdeveloped and low-income countries, including Africa, China, South Asia, and even more close to home in Toledo, Ohio, there's a water crisis where the tap water is polluted and it has harmful toxins that are not safe for consumption. So the lack of sanitary water sources increase the probability of stunting and health deficits. And this is because sanitary water conditions are necessary to ensure healthy growth and development outcomes for children. So many studies revealed that increase in growth outcomes happen for children who have proper wash protocols within their household. So what is considered to be improved water supplies is still providing unsafe drinking water conditions. So we need to reevaluate all of the sanitary protocols that we have in place to reorient goals that will make proper water quality for everyone. So awareness interventions can catalyze more effective WASH practices. Underdevelopment regions have heightened cases of child-promoted illnesses from lack of sanitary practices, and this includes frequent child-fecal interactions. And it is within the first 3 years of life that children are more susceptible to environmental influences on development and can develop sickening, life-threatening diseases. So early childhood development programs can help to more educate underdeveloped societies to practice life-saving hygienic practices. And overall education can broaden the lens of issues with WASH to set the path towards generating more and better solutions. So next, I would like to welcome Carl. He will be talking about health and biology.
Thank you, Faith. I'm Carl. The health and biology discipline basically studies the health condition of a human being. People who would engage in this action to resolve the problem are healthcare professionals and biologists as well. This is relevant to our research topic because water is a necessity and everyone needs water in order to live. The World Health Organization, also known as WHO, found that in 2022, globally, at least 1.7 billion people use a drinking water source contaminated with feces. Microbial contamination of drinking water as a result of contamination with feces poses a lot of great risks to drinking water safety, and this can also cause the transmission of diseases such as cholera, diarrhea, dysentery, hepatitis A, typhoid, and polio. In the Philippines, around 6 million Filipinos also still practice open defecation, and some 20 million lack access to basic sanitation facilities. A solution the United Nations Children's Fund, also known as the UNICEF, provided a solution that the Department of Health has prioritized ending open defecation across the Philippines, as articulated in the current administration's 12 Legacies for Health agenda. To this end, the UNICEF continues to work with the DOH to accelerate the government's Zero Open Defecation program. Lastly, WASH, also known as Water, Sanitation, and Hygiene, is ensuring that the healthcare facilities have and sustain adequate WASH services. For example, in Tajikistan, the Ministry of Health used the WASH facility improvement tool to set national targets and update national standards on WASH in healthcare facilities, and the tool that is included in the draft national health strategy. And now we will be now transitioning into the socioeconomics discipline, which Julia will talk about.
Thank you, Carl. Socioeconomics are factors that have been concerned with the interactions of social and economic factors. With this leading in the fresh drinking water, many cannot afford because of the shortage of not being able to afford it. Particularly both in the US and in Africa, there have been data found from families who cannot receive full access to fresh drinking water. 1 in 3 Africans faces water scarcity, and approximately 400 million people in the sub-Saharan Africa lack access to this fresh drinking water. Securing safe drinking water in Africa requires $35 billion in capital costs. While also leading into the United States, There have been a large number of shutoffs in Boston between 2003 and 2006, tripled due to the unaffordable water bills. People would choose to shut off their water instead of paying it because of how much the economic system has gone up within those years. Now I'll be leading into architecture by Ali.
Thank you, Julia. My name is Ali Maitland, and I'm going to discuss the architectural discipline perspective. The architectural discipline studies the relationship between designing and assembling structures, and with a new age comes new advancements. The utilization of solar energy to drive water treatment processes is a sustainable solution to the world's water scarcity issue. Regulatory maintenance and renovations of current architectural systems, such as wells, will increase the quality and quantity of the water supply. You will see below there is an image of a water treatment plant that would be found in the United States of America. This treatment plant's goal is to make water safe to drink and follows multiple filter systems that is then put to the community. In conclusion, our interdisciplinary solution is to promote awareness to the problem of access to wash and reinforce routine maintenance and sanitation policies and procedures that will continuously ensure better water quality for the health and well being of all children. Thank you for listening and have a good day.